Let's focus on myasthenia gravis. Now, myasthenia gravis is an autoimmune disease. It is your own antibodies attacking your acetylcholine receptor sites. Now, all that means is that muscle stimulation is affected. Muscle contraction isn't what it should be. So your skeletal muscles are being affected. So the muscles of your eyes, your eyelids, muscles that deal with chewing or swallowing, with speaking or breathing, and even your neck muscles. So in myasthenia gravis, again, this is an autoimmune disease. Things that you need to know for the Nclex exam is that patients will have complications with the eyes. They may have some drooping of the eyelids. They may be unable to close their eyes completely. They may have problems with vision. They may suffer from some double vision. Now, if chewing and swallowing is impaired or is affected, you always worry about aspiration. Again, you have problems with speech. These patients typically have difficulty talking or suffer from a low voice. Now, again, we worry about breathing because, again, the muscles that help the patient breathe or help a person breathe are affected. So these patients may suffer from some shortness of breath, some dyspnea. Now, again, we're always worrying about facial drooping, and our biggest concerns are really, number one, aspiration, because again of impaired chewing and swallowing, and number two, we have to worry about problems with our lungs, especially if these patients are aspirating. If they have difficulty breathing, we have to worry about low O2 sats. We have to worry about frequent lung infections. Again, number one, caused by aspiration, and number two, patients not being able to take those deep breaths in. Remember that if you are unable to take those deep breaths in, you may eventually have problems with like atelectasis or the development of pneumonia. So those are some of our clinical manifestations. Now, the things that you need to know for the Nclex exam that are very, very specific to myasthenia gravis are, number one, the drooping of the eyelids or the inability to close the eyes completely. That is paramount. Make sure you know that for the Nclex exam. Again, these patients have difficulty swallowing, talking, and chewing. So let's focus on some diagnostic studies that you must know for the Nclex exam. Number one, EMG. Now, an EMG is going to measure the electrical activity of muscles. So that is number one. But the biggest one, the one that is very, very specific to myasthenia gravis, is the tensilon test. So if you see the tensilon test on the Nclex exam, make sure that you know that that is talking about myasthenia gravis, because again, that is a very, very specific study for myasthenia gravis. Okay, so make sure you know that for the Nclex exam. Now, if the tensilon test is being performed, you must know that you will need to have atropine readily available, because the tensilon test may cause heart rhythm abnormalities. So you will need to have atropine readily available. Number three, you can test for antibodies against the acetylcholine receptor sites. Okay, so those are the three, but make sure, if you can't remember any of them, make sure that you remember the tensilon test. I've seen that on a lot of practice questions. Now again, if you're going to have the tensilon test performed, you must have atropine available. Now, what are some drug therapies that will be given to the patient? Number one, mestinon. That is very, very specific to myasthenia gravis. Number two, the corticosteroids like prednisone. Now again, I talked about how myasthenia gravis is an autoimmune disease. So we give the corticosteroids, or the physician prescribes, I should say, the corticosteroids in hopes of suppressing your immune system. If we knock down your immune system, we make it less likely for those antibodies to attack these receptor sites. You could also give something like number 3, Imurin, or number 4, Cyclosporine. All of these suppress the immune system. Now, again, this is geared towards preparing you for the Nclex exam. So, you must know the complications with the corticosteroids, Imurin, or Cyclosporine. For example, if you're suppressing these, if you're suppressing the immune system of these patients, you would want to tell them to avoid large crowds because, again, they are more susceptible to getting infections. With the corticosteroids, you must remember that it's going to cause hyperglycemia, it's going to cause weight gain. You must also inform your patient not to abruptly discontinue that medication. Okay, so don't forget the principles that we've talked about in other lectures. Begin putting it all together. But if you must remember if you could remember only one medication, it would be mastodon, because that is very, very specific to myasthenia gravis. Number 5, something else could be done, like a thymectomy or removal of the thymus gland. Now, yes, I talked about how this is an autoimmune disease, but in about 15% of the population affected by myasthenia gravis, it is actually caused by a tumor of the thymus gland. So if there is a tumor present, or if there is a thyoma present, then what would be done is a thymectomy. Now, in order to diagnose a thymectomy, or in order to diagnose whether a tumor is present or not, something like a CT of the neck would be performed. Now, moving to our interventions, you want to educate your patient on eating soft foods. Again, we talked about how these patients have difficulty chewing and swallowing, so you definitely do not want to give them a large steak. It's going to make it very, very hard for that patient to chew that. So again, you want to give these patients soft foods. You want to prevent aspiration. Number 7, you want to tell your patients to try and avoid stress, whether it is physical, emotional, or psychological stress.